All right, now let's look at erectile dysfunction. What is it? What are the different types? What causes it? And how to treat this condition? So when we talk about the erectile dysfunction, the first thing you have to think about is the majority of the cases it affects males. Everyone in their lifetime will experience it. If you haven't, you will, I promise you. But I'm going to teach you how to cope with it and how to really deal with these different kind of parameters in order to prevent it from happening ever again. Something normal, it's something natural, but it can also be an indicator of some kind of pathological abnormality. So it's really important to really figure out what's going on. So, erectile dysfunction, inability for the male reproductive system to function properly, whether it's inability to generate an erection for penetration into the vagina, or the inability to sustain proper ejaculate prematurely. So we're going to talk about premature ejaculation. So the two different types. One is called organic impotence. So this is the inability for the males usually to generate a full-on erection. So it's called inorganic impotence. And so what is the problem? What usually causes these problems here? Well, there's a lot of problems that can arise and cause this vascular problem. So usually this organic impotence is a vascular problem. It's the inability for the arteries to relax and allow for the blood to enter the penis, the erectile tissue of the penis. So what are some different causes of problems with organic impotence? Well, we can look at prostate problems. So the prostate gland is a gland that secretes certain kinds of fluid that generates the seminal fluid. Prostate problems of the prostate glands. Vascular problems. So what are some examples of vascular problems? Patients with high cholesterol. So high cholesterol, high HDLs. They have, what else? What other could be vascular problems? Problems with blood pressure, high blood pressure. These are some different problems that can arise and cause this phenomenon. What else do you think here? When we look at vascular problems. Now, when we look at other problems, for example, neurological problems are actually more common. So neurological problems can actually cause vast majority of these problems with the erectile tissue. So neurological problems, for example, certain kind of sleep disorders, problems sleeping, improper sympathetic and parasympathetic activity. So there needs to be a homeostatic balance between these two systems, right? During the erection period, this is a parasympathetic response. During the ejaculatory period, this is the sympathetic response. So neurological abnormalities can cause problems with these problems here. Certain drugs, alcohol. So alcohol is a what? Alcohol is a depressant. So all these people that have a lot of alcohol for a long period of time, they notice that they become impotent. They have an inability to generate an erection. So alcohol can do that. Certain drugs can do this as well. And again, the list can go on. There are so many different actual factors. For example, when we look at the psychological problems too, so we're looking at neurological. Now let's look at psychological. So we can look at certain kinds of relationship problems, certain kinds of childhood traumas, anything. There's so many different problems. And the one thing that's really important about these patients is that when they have erectile dysfunction, it can be really a good indicator of some other kind of pathological abnormality. So for example, diabetes is another. Diabetes mellitus can be another reason why these patients have these instances of impotence. Surgery, so after you did some kind of surgery. So again, the list can go on and on. I can talk about this forever, but I'm trying to keep this as short as possible. So you have organic impotence. That's number one. Number two here is premature ejaculation. So premature ejaculation is a phenomenon where you're intimate with the person, everything is going well, you go in 5 seconds, 10 seconds, 20 seconds, 30 seconds, and then after a moment, everything comes out. That's premature ejaculation. When you have like a abnormally early ejaculation. So for those of you that have this problem, good news. You're normal. There's nothing wrong with you. So if someone says they're wrong with you, they're lying to you. If you think about it, back in evolutionarily terms, while you're in the jungle, and if you're basically, you have a short burst of time, the whole purpose of the reproductive system is to do what? Is to produce offspring. Humans came in and modified it for a different purpose, which is fine, right? That's called how we evolve and we adapt. So now what's really important is when you're in the jungle and you don't want to die, but you want to also produce offspring, what is the most effective way of generating this problem? You want to be able to ejaculate as soon as possible. So whatever animal you chose, the bear, the panda, the lion, the gazelle, whatever, in order for them to not be in a very vulnerable position, because while you're in intercourse, you're very vulnerable, you want to ejaculate as soon as possible. So having premature ejaculation actually gives you an advantage in a more of a offspring production way. So if you want to think of it that way, you can always argue your case all the time. But you realize, you know what, I don't want this. I want to satisfy my partner, whatever. It's okay, you can do whatever you want. But again, there's always a reason for everything. The reason why a lot of people experience these organic impotence or premature ejaculation, remember, majority of this is neurological. And neurological can be influenced by the emotions. So people that have certain kind of emotional or psychological problems. So think about it, when you have an ejaculation, that is not mechanically stimulated from the penis. The actual orgasm that's generated is from your brain. So if you have a problem, some kind of psychological or neurological problem with your brain, you can experience these symptoms of erectile dysfunction. So you decide, okay, premature ejaculation, I can deal with that. But for some reason, I cannot have a erection. So I'll even keep it blue. Let's talk about drugs. So the number one drug out in the market right now, it's called Viagra, the blue pill. There's pink ones too. I don't know what they're really called, but I don't know if they work either too, but there is a pink one as well. But Viagra, originally thought of as a blood pressure medication. One of the side effects was male erection. So the doctor, I think it was in Florida, where they came in, they were trying this drug for blood pressure. Some patients kept asking for more and more and more and more because they loved the side effects of it. So then this became a $1 billion market, and now the person who created this is living a very comfortable life. And so Viagra, and what's really important about Viagra too, that people don't understand, is that when you take Viagra, most of the cases you don't need it, but you need to be in some kind of excited state. You can't just take the pill, sit on a couch and expect to get an erection. So Viagra, you need to be in a more of an actual excited, motivated state to have intercourse. If not, it's a complete pointless. On the other hand, for those of you that get nervous all the time and you have this problem, and if you're young and you don't have this problem, mainly it's psychological, it's really dangerous to take this. You don't want to wake up after taking Viagra having an 8 to 9 hour boner, because usually you will eventually have what? You'll have to go to the hospital, because that can cause fibrotic tissue to be damaged in the penis, and that can cause certain kind of impotence to become possible. So if all of this doesn't work, so what is my message? What is the ultimate treatment for patients with erectile dysfunction? So that's what you're waiting for from the beginning to the end. And this is the treatment. Relax.